is Jessica DeMassa, and I'm in the HISA Studio here at HIC 2017, and I'm with Berne. Berne, please introduce yourself for everybody watching.
Yeah, hi, I'm Berne Gibbons. I'm the Director of Vitro Software here in Australia.
It's fantastic. So tell me exactly what your software does.
Yeah, so we take a paper form in a hospital and we digitise the form, and so that it makes it available not only to the clinicians but also into other systems in the hospital.
Okay, fantastic. So it digitizes something that's paper.
That's right.
Where there's a lot of paper in healthcare, and so this is a massive solution to a huge problem.
Yes, that's right, because a lot of the hospitals, they can't afford to go to the big EMR straight away, and also with new technology it's not required any further that we do go to something that is on big servers, that we can go to the cloud and store all of the records in a hospital and share those records with other systems that they're already using.
That's fantastic. So it sounds like, there's a lot of different ways that a healthcare organization can become digital, and this sounds like a pretty easy step to take.
Yeah, it is, and that's something, I'm glad you mentioned that, because it's something that we get a lot of feedback on, is that taking a paper form and digitising it means that in the hospital there's virtually no change management. The nurses and the doctors are still using a form that's familiar to them, only it has a lot more intelligence behind it. So it's able to be used to calculate, and it has algorithms and other decision support as well that sits behind it, and at a minimum of the cost of a big EMR.
Oh, that's fantastic. Yeah. And I like, too, that it's meeting the health system kind of where it's at.
Yes,
so to
exactly, yes. So,
fantastic.
Yeah, available on small, devices, so doctors can check their patients' records on the go as well.
So tell me a little bit about, from your perspective, I'm curious to know, we've been talking about the digital health transformation basically here in Australia. And so what are you seeing from your vantage point? Are most organizations ready for this? And if they're not, how can they be?
I think that's a good point, because I think that years ago, there was this decision made by government in Australia that they would fund the big EMRs. And so it's taken, though, quite a while to roll those EMRs out. And of course, technology has moved forward, and we expect now to be able to, take a document and have it digitised and made it available to you, so that you can fill it out and use it faster than actually the EMR technology allows you to do. So we're at a very good point now, I believe, in Australia for this type of technology, and in fact in other verticals in healthcare, such as aged care and the NDIS, it's perfect now as they start to go digital. This is a new way for them to go. But interoperability is the most important thing that we need to be making sure that the healthcare industry in Australia is aware that it's not so hard to interoperate with all of the other systems, and that's what's really going to put healthcare ahead of the other industries, like banking, for example. You need to be able to share your information with other systems.
No, that's fantastic. And so, as far as overcoming that obstacle, what's your sense of how long something like that is going to take? Is this a near-term solution, or is this something that you think is going to take a while?
No, it is a near-term solution. It's happening right now. We just need to be brave, I suppose, and step away from the belief that it's going to take a long time to get a solution and systems into place, and that if we use new technology and start to adapt and interoperate with all of the other systems, then it's all possible. It can be done today. It is being done today.
Fantastic. Yeah. So last question for you. What has you most excited about the future of health as it's unfolding here in Australia right now?
Is the newer generation coming through. They don't have the fear of sharing information. So I think that's what I feel like. I grew up in nursing, pharmaceutical industry, and I've been waiting for this new generation of healthcare professionals to come through who pick up a device and use it, and expect that when they get into a hospital. Now I'm a doctor. Where is this information? And you're handed a paper, a fax machine or a big folder. So I think that's the most exciting part. Let's get more of those, the younger generation, to have a voice.
Fantastic. Well, Berne, it was so nice to talk with you. Thank you so much.
Thank you.
You.
Thanks so much.
I'm Jessica DeMassa here at the HISA Studio at HIC 2017. Thanks so much.